This talk is about Evita's secret prefrontal lobotomy, a story of discovery, intrigue, and medical ethics. I am Dr. Daniel Nijensohn. I am a neurosurgeon. My home is in Fairfield, Connecticut, in the United States of America. I was born in Argentina. I train at the Mayo Clinic, and I am a Yale professor. And this talk is Yale, Mayo, and Argentina centric. It is about neurosurgery, about the human brain, and about the interconnections and the flow of information that goes through the almost 100 billion brain nerve cells. This talk is about psychosurgery for pain and for aggressive behavior in 1952, and it is about Eva Peron, Evita. Let me take you to a place far, far away, to a long time ago, Argentina, 1952. I met Eva Peron when I was a young child. It was in Mendoza, Argentina, my birthplace, in December 1950. And even though more than 6 decades have gone by, these memories are still vividly inscribed in my mind. With the help of a team of collaborators, I uncovered a state secret that was never meant to be revealed. This information is still sensitive in Argentina. It must be considered in its time and place. It deals with psychosurgery, politics, history of medicine and history of Argentina, state secrets, the ethics of neuroscience, and medical professionalism. The initial work was done in 2010 by a medical team led by me from top universities in the US and in Argentina. These are the shields of those universities. The initial investigation was published in 2011 and 2012 in peer-reviewed scientific medical journals, from right to left in Spanish first, in the journal Neurotarget, and then in English in the journal World Neurosurgery. The World Neurosurgery 2012 article's title was New Evidence of Prefrontal Lobotomy in the Last Months of the Illness of Eva Peron. And in July 2015, Neurosurgical Focus of the Journal of Neurosurgery of the American Association of Neurological Surgeons published my article, Prefrontal Lobotomy on Evita was done for behavioral personality modification, not just for pain control. And in November 2015, the Journal of Clinical Neuroscience published the article Evita's Lobotomy, written by Harvard and Yale faculty, including me. Argentina, in the southern cone of the continent, is a large and beautiful country. And famous Argentines include, among others, Francis, the Pope of the Catholic Church, born Jorge Bergoglio, Maxima, Queen of Holland, 5 Nobel Prize winners, General San Martin, liberator of Argentina, Chile, and Peru, El Che Guevara, and Eva Peron, better known as Evita. Buenos Aires, the Queen of the Plata, remembers, adores, and sometimes abhors the memory of Evita. Immediate past President of Argentina, Miss Cristina Fernández de Kirchner, is a strong follower of Evita's ideals. And this is Buenos Aires, Avenida 9 de Julio, the widest in the world. And please notice the black arrow in the left upper corner in the 9th of July Avenue. It is pointing at a government building. And 65 years after her death, it has a giant metal portrait of Evita on one of the walls. She is delivering an angry harangue, a fiery speech. And Evita's portrait on the other side of the building smiles from above. This is the portrait of Evita at night. And at the posh Buenos Aires neighborhood, there is the Recoleta Cemetery with the Duarte Mausoleum and Eva Peron's crypt. Paradoxically, at the cemetery where her enemies, the quote oligarchs and landowners, close quote, rest. The death of Eva Peron on July the 26, 1952, at 8:25 p.m., at age 33, childless, at the peak of her power, caused great commotion in Argentina and in the rest of the world. Evita is a well-known historical figure of the 20th century, also a myth. Evita preceded 2 female presidents of Argentina, Isabelita, president between 1974 and 1976, and Cristina, president between 2007 and 2015. She was a precursor of revolutionaries. This is the Che Guevara's metal portrait in the Plaza de la Revolución in Havana, Cuba, similar to Evita's in Buenos Aires. Not a coincidence. Evita is found in Broadway and in Hollywood. Who was Eva Peron, better known as Evita? Born in 1919 and died in 1952, she was the second wife of Juan Perón. Juan Domingo Perón, born in 1895, died in 1974, was 3 times president of Argentina. He was 24 years her senior. Perón was an admirer of Mussolini and of Hitler, and served as military attaché at the Argentine embassy in Rome at the beginning of World War II. When he returned to Argentina, he started a political movement known as Peronism or Justicialism. Juan Perón considered himself an intellectual. He spoke several languages, including Italian and German, in addition to Spanish. He was a professor of military history at the Army College, and as a young colonel, he was an organizer of a secret society named GO. Gou. And what about Evita? She was an, quote, illegitimate child, a high school dropout, and in 1941, a radio and B-movie actress. She was first a mistress, and by 1946, the second wife of the democratically elected President of Argentina, Colonel, then General, Juan Domingo Perón. Eva Peron was a blonde Cinderella who went from rags to riches. Here she is, dressed in Dior couture. She favored Van Cleef and Arpels jewelry, expensive gowns, fancy limousines. She was the head of the powerfully rich Fundación Eva Perón and head of the female branch of the Peronist Party. Evita was charismatic, and she and Juan Perón formed a couple. Were they a loving couple? They certainly were a handsome couple. They were a power couple. She was a forceful speaker, the leader of the left wing of the party, the head of Evitism within Peronism. She was a self-described fanatic revolutionary, an idol of the left. And this is Evita in December 1950 at her peak. And then she became ill and died. And Evita's illness, treatments, and death is a history of pain and sorrow, full of conspiracies, schemes, plots, lies, deceit, secrets, misinformation. Evita got sick in January 1950. She was anemic. She had suffered from vaginal hemorrhages. There was a palpable uterine mass. She went under the care of a government minister, Dr. Ivanisevic, a surgeon and a far-right politician. He diagnosed her as suffering from acute appendicitis. She had surgery. The appendix was normal. On August 22nd, 1951, at a rally at the Avenida 9 de Julio in Buenos Aires, a crowd of almost 2 million Peronist supporters, quote, convinced Evita to accept the candidacy to the vice presidency of Argentina for the Peronist Party. The crowd clamored for a Perón ticket. But this was, quote, blocked by her own husband, President General Juan Perón, and she was asked by him to renounce, which he did, on a radio speech on August 31, 1951, and this is known in Argentine history as the renunciation. Soon after, Evita, already ill, purchased weapons without Juan Perón's knowledge and without the knowledge of the armed forces to defend him, and started organizing workers' militias to, quote, defend him from his enemies. At the end of September 1951, Evita underwent a cervical biopsy by Professor Dr. Humberto Dionisi from the University of Córdoba in Argentina. The pathology showed cancer of the uterine cervix, invasive. In October 1951, she underwent preoperative intravaginal radium therapy as per a Buenos Aires gynecologist, Dr. Albertelli, The treatment was done at the presidential mansion, Palacio Unzué, where the National Library of Argentina is now located. On November the 5th, 1951, she was admitted to the Polyclinic Presidente Perón, Fundación Eva Perón, in Avellaneda, Buenos Aires, a brand new state-of-the-art hospital. And this photograph is the night before surgery, before the radical hysterectomy, and the photo shows Dr. Albertelli, President Peron, Evita, and Dr. Ricardo Finocchieto, a very well-known Argentine surgeon. Argentines were told that Dr. Finocchieto was the chief surgeon at the operation. The surgery was on November 6, 1951, and it was only in the 1990s that it was revealed that Dr. George Pack had been the surgeon. He was a surgical oncologist. He was brought from Memorial Hospital Sloan Kettering from Manhattan, New York, and because of anti-Americanism, this was kept secret until the 1990s, when it was disclosed by the participants before their deaths. Evita never met Dr. Pack while awake and was never told directly of the diagnosis. Obviously, there was no informed consent, and this is a case of medical paternalism, and this is what I call the first big lie. In 1952, Evita was anemic and in pain, agitated and anxious, angry and belligerent, and underwent external beam radiotherapy and blood transfusions. She was the first case in Latin America to receive intravenous chemotherapy for cancer, nitrogen mustard, treatment developed by Goodman and Gilman at Yale University in New Haven, Connecticut. This is May the 1st, 1952, Labor Day in Argentina and in most of the world, her last public speech. It was full of anger and belligerence, inciting violence. She attacked her enemies ferociously, particularly the army, using violent threats in, quote, turbid language. And she said, quote, if it is necessary, we will execute justice with our own hands. For beware of that day when I will go down with the working people, I will go down with the women of the people, I will go down with the descamisados, and I will leave nothing standing. Those who believe in sweetness and love forget that Christ said, I have come to earth to bring fire so that it may burn more. This is June the 4th, 1952, her last outing. It was the inaugural of the second presidential term of Juan Perón. She is seen standing on a convertible Packard automobile, wearing a fur coat. By the way, June, fall, winter in the southern hemisphere, is already cold in Argentina. We know now she was concealing a metal harness that kept her upright. This is at the end of June 1952. Her body weight was down to 36 kilos, 80 pounds, and it has been written, quote, the last 2 months of her life, Evita was intermittently lucid, quote. She died on July the 26th, 1952 at 8:25 p.m. And from that moment on, and until September 16, 1955, when the coup took place known as Revolución Libertadora, there was a daily repetition on radio and TV at precisely 8:25 p.m., pausing all programs to say, quote, It's 2025, time when Evita, spiritual leader of the nation, passed into immortality. This is a photograph of Evita's funeral in Buenos Aires on August the 9th, 1952. It was huge, majestic, impressive. Evita's body was embalmed by Dr. Pedro Ara, a Spanish anatomist, professor of anatomy in Córdoba, Argentina. The body was preserved to look as if in a sleep-like state. The procedure worked, and the body showed no signs of decomposition when Eva was buried at her final resting place at the Recoleta Cemetery many years after the initial procedure. There is a white myth about Evita. She has been called, quote, the repentant sinner devoted to charity, the mother of the poor, the lady of hope, the sister of the afflicted. There are busts of Evita Peron all over Argentina. This one is in Ushuaia, Tierra del Fuego, and my wife Goldie is standing next to it. She has been called a saint, a santa, like in the book of Thomas Eloy Martinez, Santa Evita. And with an Argentine Pope in the Vatican, perhaps we will see a Saint Evita. There is also a black myth, and she has been called satanic, a serpent, a power-hungry prostitute, bloodthirsty, conspiratorial, divisive. In this illustration, there is a photograph of me at the age of 6 and the front page of my reading primer titled Evita. This was Mendoza, 1952. And this is the book that I used to learn to read. And it says, Esa es mamá, that is mom. Esa es Evita, that is Evita. Viva mamá, viva Evita. And I participated in a school competition. And my winning essay in 1953 about Evita was rewarded with Evita's stamps. My mission in life, a compulsory school textbook, was written by a ghost writer and includes more lies. Evita received at the end of her life a large number of awards, massive flattery, and adulation. And Evita's body suffered from post-mortem travails. In September 1955, a coup took place, known as Revolución Libertadora, and the military junta ordered that Evita's body mysteriously disappeared. We now know that it was secretly interred in Italy for 14 years between 1955 and 1969 under a different name. In 1969, the embalmed body was returned to Juan Perón, who was at that time exiled in Madrid, in Franco's Spain. In 1972, Juan Perón returned to Argentina from a 17-year exile in Madrid. And in 1972, the body of Evita returned to Buenos Aires, was restored, and was exhibited at the presidential retreat of Olivos between 1974 and 1976. Then, at the time of the military coup of 1976, a decision was made to move Evita's body to the Duarte Mausoleum in the Recoleta Cemetery. I suggest now an intermission of a few minutes. And this is part 2. I am Dr. Nijensohn. I am a neurosurgeon. My home is in Fairfield, Connecticut. And these are some of my credentials. I am telling you about the secret of Evita's lobotomy with no conflict of interest and no political message. In 2010, I worked with Dr. Luis Savastano on the biography of Dr. George Udvarhelyi, a Hungarian, Argentine, American neurosurgeon. And through serendipity, we stumbled onto this amazing secret. Dr. George Bela Udvarhelyi was born in Budapest, Hungary in 1920 and was a member of the Wallenberg Network during the war. He lived in Argentina between 1948 and 1954 and came to the States and became a professor of neurosurgery at Johns Hopkins University Medical School in Baltimore, Maryland. In an interview with the Baltimore Sun in 2005, he said Eva Peron underwent a prefrontal lobotomy in 1952 and I participated in the surgery. This was read again in the Baltimore Sun in the 2010 obituary of Dr. George Udvarhelyi. Dr. Udvarhelyi also stated that a prefrontal lobotomy was performed on Evita Peron for the pain, and afterwards she became an emaciated lady. We saw her several more times. She became quite a pathetic person. So we started a research project to investigate Dr. George Udvarhelyi's shocking claim that Eva Peron, Evita, underwent a prefrontal lobotomy at the time of her terminal illness in 1952. And about prefrontal lobotomy, the operation, although bizarre, was the state of the art, a treatment of last recourse for pain, especially from cancer, and for anxiety and agitation in 1952? If so, why then such a long-lasting, strictly enforced, well-kept state secret? First, let me describe the birth of prefrontal lobotomy. The operation was born in 1935 at the Frontal Lobe Symposium in London, England, when Fulton and Jacobsen from Yale University reported that frontal and prefrontal cortical damage in chimpanzees led to a massive reduction in aggression, while complete removal of the frontal cortex led to the inability to induce experimental neurosis. And on hearing this presentation, a member of the audience who was a professor of neurology at the University of Lisbon Medical School in Portugal asked himself if the surgical procedure would be beneficial for people with otherwise untreatable psychosis. He was Igas Moniz, Antonio Caetano de Abreu Freire. He went from London, England to Lisbon, Portugal, and convinced his colleague Pedro Almeida Lima, a neurosurgeon, to start a program of procedures on psychiatric patients, inmates at an asylum for the insane. First, injecting pure alcohol into the frontal white matter, and then surgically sectioning it. The operation was named by them Prefrontal Lobotomy or Leucotomy. Leuko, from Greek, means white, from white matter. And the idea was to separate the ventromedial orbital prefrontal area from the thalamus and the central cerebral nuclei. It became known as the white cut, the cutting of the mind, or, quote, damaging the brain to save the mind, and eventually evolved into taking small cuttings of patients' frontal lobes using instruments known as leucotomes. In 1949, Igas Moniz was awarded the Nobel Prize in Medicine, quote, for the development of prefrontal lobotomy. It must be mentioned that Moniz also developed cerebral angiography in 1927. And in the US, just shortly after the Portuguese team, and at George Washington University in Washington, D.C., neurologist Walter Freeman and neurosurgeon James Watts started a program of lobotomies they call, quote, standard. Eventually, they evolved, particularly Freeman, in doing transorbital lobotomy. Using a common ice pick and with the patient anesthetized through electroshock, a surgical technique suggested in 1936 by Dr. Amaro Fiamberti in Italy was developed by Dr. Freeman, the transorbital ice pick approach, in 1937. Many patients were operated and had lobotomy, including Rosemary Kennedy, a younger sister of John Fitzgerald Kennedy, among many others. And in 2015, I wrote an article together with a colleague and friend, Dr. Isaac Goodrich, also a Yale professor, named Psychosurgery, Past, Present, and Future, including prefrontal lobotomy and Connecticut's contribution. John Fulton is the acknowledged father of psychosurgery. This is the Yale University School of Medicine. And after all, Harvey Cushing, the acknowledged father of modern neurosurgery, was a Yalie, as John Fulton, the acknowledged father of psychosurgery, who was Cushing's friend and disciple. An innovative researcher at Yale was Dr. Delgado, and another distinguished neurosurgeon and psychosurgeon, Dr. William Scoville, Yale professor, who did most of his work in Hartford at the Institute of Living and at the Hartford Hospital. Now, which one were the indications for a prefrontal lobotomy/leucotomy in the 1940s and 50s? The main indications were mostly three. Number one, psychiatric illness, neurosurgery for mental disorders, as treatment for agitation, anxiety, madness, disintegration. Number two, intractable pain, mostly in cases of terminal cancer. And number 3, mind control, behavior and personality modification, mostly for management of violent behavior. This was the most controversial of the 3 main indications. Regarding violence and aggression, in the book Surgery of Violence, Vernon Mark, a neurosurgeon, and Frank Ervin, a psychiatrist, of the Boston City Hospital in Boston, Massachusetts, quoted an aphorism of Hippocrates. Quote, extreme remedies are very appropriate for extreme diseases. Mark, Ervin, and William Sweet, professor of neurosurgery at Harvard and chief of neurosurgery of the Massachusetts General Hospital, wrote during the civil unrest of the late 1960s in the US, quote, pacify the leaders of the urban riots through lobotomies. Another great and very well-known lobotomist was Dr. James Leonard Poppen, the head of neurosurgery at the Leahy Clinic in Boston, Massachusetts. Dr. Poppen advocated the so-called superior approach, superior because he would come from above, do incisions through the scalp in front of the coronal suture, and then circular trephinations, removing bone buttons and or rondelles, and then after opening the coverings of the brain known as the meninges, mostly the dura, enter the white matter of the frontal lobe to perform the lobotomy. And this is a human brain showing a bilateral prefrontal lobotomy done through a, quote, superior approach, quote, a la Poppen. And this is a CAT scan of the head showing frontal radiolucencies in the area of the white matter consistent with bilateral frontal lobotomies or leucotomies. In this book, Elliot Wallenstein described the rise and decline of psychosurgery and other radical treatments for mental illness. Wallenstein, a professor at the University of Michigan, Ann Arbor. In 1953 is the beginning of the era of psychopharmacology with the arrival of chlorpromazine, thorazine. Too often, the line between a desired effect from the lobotomy and a side effect was very thin, and this is the basis of the ethical problem. Moniz strongly believed that the potential benefits of surgical lesions in the frontal lobes, even allowing for some behavioral and personality deterioration, outweigh the debilitating effects of severe psychiatric illness. But the fact is that although patients were no longer distressed by their mental conflicts, pretty much all of them seemed to have little capacity for any emotional experiences, and they were described again and again as dull, apathetic, lethargic, docile, basically like zombies. Eventually, there was a big reaction against the operation. Some of it came in the form of books and or movies against the most questionable and controversial indications, in particular when psychosurgery was being done for personality and behavior modification, especially so for political reasons, on nonconformists, dissenters, rebels, and renegades. And in California state prisons, Atascadero and Vacaville, brain surgery was tested on convicts. Lobotomies were done to modify personality and change behavior and control violence. This a type of surgery done on convicts, we will see Dr. Poppen also did in Argentina. The National Research Act of July 1974, written by a committee led by Kenneth John Ryan as chairman, produced the Belmont Report, known as Ethical Principles and Guidelines for the Protection of Human Subjects of Research. It must be mentioned that critics of psychosurgery intended the National Commission to completely ban psychosurgery, but instead the Belmont Report concluded that psychosurgery could provide meaningful benefits to many patients with acceptable risks and should not be abolished outright. Now, going back to Evita, George Udvarhelyi can be seen young and adult in this illustration. We found evidence that gives validity to Dr. George Udvarhelyi's claim that Eva Peron Evita underwent a prefrontal lobotomy in Buenos Aires, Argentina in 1952 that was done for treatment of pain, anxiety, and agitation secondary to uterine metastatic cancer, that Dr. James Leonard Poppen was involved in the case. And we also initially suspected and then confirmed that was done for behavior personality modification for political reasons and objectives. This is a partial photograph of the Department of Neurosurgery at the Mayo Clinic, and arrows and asterisks show first Dr. Ed Loss on the right side, one of my mentors, and in the back I am standing, and a second to the left. Now, Dr. Loss was the favorite student of Dr. Udvarhelyi in Baltimore, Maryland at Johns Hopkins. I met Dr. Udvarhelyi through Dr. Loss when Dr. Udvarhelyi came to the Mayo Clinic in 1974 to lecture as a visiting professor. And this is a picture showing Dr. Loss as visiting professor at Yale, November 2012, Dr. Spencer, Dr. Loss, and myself. Now, we were looking for hard evidence, and we learned that by order of the junta, in October 1955 in Buenos Aires, X-rays were obtained of the embalmed body of the Evita. The military wanted to make sure that what was in the Union Central building was indeed the body of Evita and not just a doll. And X-rays were done with a portable X-ray machine by Dr. Guido Gotha, then president of the Argentine Society of Radiology. We learned that those X-rays of the embalmed body of Evita taken in 1955 were in the hands of Dr. Gotha's son, Dr. Cesar Gotha, and his associate, Dr. Buzzi, in Buenos Aires. And in 2010, we approached Drs. Gotha and Buzzi and asked for the X-rays. They sent them to us, including chest, abdomen, and the limbs. The X-rays showed widespread metastatic disease. But what about the skull X-rays? When we asked for them, they told us those X-rays were lost, and we felt we had arrived at a dead end. But in a documentary made in 1997 by Tristan Bauer, known as Evita, La Tumba Sin Paz, we found X-rays hanging in a view box in one of the frames of the movie. we were able to freeze the frame containing the lateral x-rays of the skull. And eventually, we were able to enlarge and change contrast and found, as the arrows indicate, two radiolucencies of circular shape. These two circular radiolucencies with central opacities located at the coronal suture are consistent with trephinations. These post-mortem Evita's lateral skull X-rays from October 1955 shows images consistent with trephinations. So the diagnosis was that we were looking at trephination openings partially filled with wax and or bone buttons known as rondelles. And this is the artist's rendition of the bilateral frontal trephinations in the superior approach a la Poppen, done for bilateral frontal lobotomies and or leucotomies. The findings were of an explosive nature. And who was the neurosurgeon? We eventually deducted and confirmed that Dr. George Udvarhelyi assisted in a prefrontal lobotomy on Evita, a surgeon that came from Boston, Massachusetts, Dr. James Leonard Poppen. Dr. Poppen was a lobotomist par excellence, a great South American traveler, a neurosurgeon to the stars, and the author of a very well-read and consulted atlas of neurosurgical techniques. He was the chief of neurosurgery at the Leahy Clinic and a neurosurgeon in the New England Baptist Hospital and in the New England Deaconess. Dr. Poppen was born in 1903 in Michigan and died in 1978 in Massachusetts at the age of 75. I met him at meetings of the New England Neurosurgical Society. He was, back in 1952, perhaps one of the best neurosurgeons in the world. He was a friend of General Peron, a supporter of Peron, the writer of the book Peron the Man, decorated by the Argentine government in 1952 and 1954. He was made an honorary member of the Argentine Society of Neurology, Neurosurgery, and Psychiatry. He was a mentor to Dr. David Fireman, a Buenos Aires neurosurgeon. And in the alumni newsletter of the Leahy Clinic News, spring 1998, we read that in regards to famous alumni, neurosurgeon James Poppen, MD, was summoned to Buenos Aires to operate on Evita Peron and to Los Angeles when Senator Robert Kennedy was shot. And we also learned at the Hope College in Michigan that the fraternity Omicron Kappa Epsilon includes in the membership James Leonard Poppen, MD, physician to Argentina's Evita Peron and Senator Robert Kennedy. We met Dr. Gerwin Neumann, Dr. Poppen's last fellow and associate. I had known Dr. Neumann for decades, both members, he and I, of the New England Neurosurgical Society. Dr. Neumann was born in Chile, and he confirmed that Dr. Jim Poppen, the bear, operated on Evita, and he introduced us to Manena Riquelme RN, Dr. Poppen's scrub nurse and confidant. Manena said Dr. Poppen did a prefrontal lobotomy on Eva in 1952 and also on a few prisoners in Buenos Aires. Again, Manena Riquelme, a former scrub nurse and confidant of Dr. James Leonard Poppen. They are seen here in this photograph in Boston, Massachusetts in 1965. Manena spends half of the year in Chile and the other half in North America. She's difficult to find. We went all the way to Chile to talk to her and interview her in September 2012. The interview was led by well-known Buenos Aires journalist Dr. Nelson Castro, who also wrote and published a book, Los Últimos Días de Eva, Historia de un Engaño. And we found these photographs in Buenos Aires, kept by colleagues. In this one, we see Dr. Poppen, Dr. Fireman, Dr. Finocchieto and President Peron at La Casa Rosada, the government house in Buenos Aires, June 1952. And in this photograph, we see Dr. Poppen with Dr. Finocchieto, Buenos Aires, July 1952. And Mrs. Poppen owned some of Evita's jewels given to Dr. Poppen by President Peron after the operation on Evita. Who assisted Dr. Poppen? Dr. David Fireman, his former fellow and translator while in Buenos Aires, Dr. George Udvarhelyi, who was then a neurosurgical resident at the Neurosurgical Institute Costa Buero of the University of Buenos Aires, most likely with the presence of Drs. Matera, Carrillo, and Finocchieto. Where did the operation take place? In the presidential palace Palacio Unzué, in a bedroom that was converted into an operating room. We also know that there were armed guards inside the operating room, as per a 2011 letter sent to me by a colleague, Dr. Yancy Beamer, a California neurosurgeon. He had the chance of discussing this case with Dr. Poppen at the end of a meeting. Dr. Poppen confided on him that he had operated on Evita and told him that he was surprised that were armed guards inside the operating room because of the political turbulence of the times. This is the Palacio Unzué that again was torn down in 1955 at the time of the military coup that brought down the government of Juan Perón, and this was done to prevent the house to become a shrine to the memory of Evita. When did the surgery take place? It was in June 1952. And what were the indications? Well, number one, control of pain, intractable pain from metastatic cervical uterine cancer, as well as agitation and anxiety related to it, but also for personality and behavior modification, for management of violent behavior disorder, for political reasons and objectives, mainly to avoid a bloody civil war between the left and the right wings of the Peronist Party. It was a time of terror and a time of threats. Unfortunately, Evita stopped eating after the lobotomy and became emaciated and pathetic, as per Dr. Udvarhelyi, both in his declarations to the newspaper and in his personal diary. Evita died a few weeks later. So the facts are that Evita was suffering from a fatal illness and from intractable pain and from increasing anxiety, agitation, and belligerence. The fact is that she ended up dying at the age of 33, at the peak of her power, and that she was suffering from metastatic cervical uterine cancer, and that she had a prefrontal lobotomy. As mentioned, it was time of dictatorship, political turbulence, palace intrigues, internal fights among members of her team of physicians and surgeons, and it was a time of nationalism and dislike of foreign intrusion, in particular from US physicians and surgeons. All that contributed to the secret and the silence. It was a totalitarian, authoritarian, populist regime with labyrinthine, Byzantine politics. There were state secrets, there was the Hippocratic Oath mandated secret, there were lies and deceit and misinformation, and serious fights between the left and the right wings of the Peronist Party and between the Peronists and the anti-Peronists, known in Argentina as the guerrillas. I base some of my thoughts on the work of Loris Zanata, a professor of Latin American history at the University of Bologna, Italy, a distinguished political scientist, who wrote the book Eva Peron, Una biografía política, a political biography. According to Loris Zanata, Evita prided herself on being a fanatic in 1952. Evita's last public speech on May 1st, 1952, was emotional and angry, calling for violence. And Loris Zanata writes in Eva Peron, a political biography, that Evita's political birth started earlier than is commonly accepted and was parallel to that of Peron's, that there was an inevitable and growing competition between the two of them, that Argentina's Peronism was bicephalic in 1952, and that there was no loving relationship between Juan and Eva. And Evita's true testament, Evita's signed document, showed up and was made public in the past few years. She dictated a 79-page document testament known as My Message that clearly shows evidence of her belligerence and violent state of mind. She spoke about the enemies of the people that were insensitive and repugnant, and as cold as toads and snakes. She exalted the holy fire of fanaticism, and she was, quote, against those imbeciles that call for prudence. And she called on the people of Argentina to, quote, fight. Now, what likely initiated the process that led to the lobotomy was the arming of the militias. Evita purchased 5,000 automatic pistols, 1,500 machine guns, and a large amount of ammunition from Prince Bernhard of the Netherlands, a known arms dealer known as the Black Prince, and started training worker militias in 1952 at Cerrito Island in El Chaco province in northeast Argentina. This was done without the knowledge of her husband, General Juan Perón, nor of the Argentine armed forces. Back to Juan and Evita. Were they a happy couple? The myth is that they were a loving couple. Evita and Juan. They appeared very happy through propaganda. They were, as previously said, a power couple. Like in more recent times in Argentina, Nestor and Cristina Kirchner. Juan and Evita seem to have been unhappy and unloving. Perón was disgusted with Evita in August 1951, worried that she wanted to be vice president in order to displace him and eventually replace him while in office. He didn't show too much love towards her. In fact, in the last 2 months of Evita's life, it has been written, quote, Perón exhibited his dying wife in lurid context. Eva was placed in a back room in the presidential palace. Perón entered her room very rarely, keeping a muslin mask over his face like a beekeeper. The room had a hospital bed and surgical tools. This is as per Fraser and Navarro in Eva Perón, a biography. Perón has been quoted as saying that the only person he was afraid of was Evita and her followers. We say the surgery was done not only to control intractable pain, agitation, and anxiety from metastatic uterine cancer, but for behavior and personality modification and control of aggressive behavior. There were clear political objectives with the purpose of avoiding a bloody civil war in Argentina between the far left, led by Evita, and the far right, where Juan Perón really belonged. This violent confrontation unhappily took place in the 1970s. 20 years later, its repercussions are still felt today. Juan Perón is not loved by the true followers of Evita. Although he was the great conductor, he was a far-right fascist and national socialist, disliked by the far left, Montoneros, La Cámpora. Evita's prefrontal lobotomy was performed for raison d'etat, with political objectives, led by her husband, General Perón, who ordered the operation. Dr. Poppen was just an instrument. It was done for mind control. And I accuse those who insist on purposefully keeping secret a story that by now the public should know in detail. The motto of Yale is Lux et Veritas, light and truth. I accuse General Perón for asking Dr. Poppen to do a lobotomy on his dying wife, not just for pain relief, but also with political intentions and objectives for behavior personality modification. And I also accuse the victim, Eva Perón, Evita, for calling for a bloody revolution and inciting a civil war. This is a giant contemporary propaganda billboard of the Peronist Party. The operation was done without obtaining an informed consent, without even Evita's knowledge. Dr. Poppen seems to have become a tool of the state. All this has to do with ethics and medical professionalism. Nurse Riquelme disclosed that Dr. Poppen, asked by General Juan Perón, performed a prefrontal lobotomy on half a dozen political prisoners in Buenos Aires prisons. Incidentally, American neurosurgeons, as I already mentioned, in state prisons in the US, i.e., at Atascadero and Vacaville in California, also performed the operation for, quote, violence reduction and behavior modification. This story must be put in its time and place. Although it occurred before the Belmont report, it also happened already after the Nuremberg trials. There is the issue of informed consent, of Evita's knowledge, of the surgeon being used as a tool of the state, and the issues of neuroethics and medical professionalism. Manena Riquelme stated that Dr. Poppen was very secretive all his life about these events, in part because he had been asked not to talk about this, and also because he felt bad about it. One wonders if in the end Dr. Poppen realized he had been used in a macabre political game. In the 20th century, both in communist Soviet Union and Red China, and in fascist Nazi Germany, medicine regressed after these authoritarian systems corrupted the ethics of the medical profession and forced it to descend into unprecedented dark barbarism. The Soviet psychiatrists and the Nazi doctors were physicians willingly cooperating with the totalitarian state, allegedly in the name of the collective good, at the expense of their individual patients. There was a great media impact after the publication of my papers. Newspapers, first in Argentina, then in the UK, the New York Times, and at home in Connecticut, the Connecticut Post, the BBC, the gruesome untold story of Evita Peron's lobotomy, and in different languages, countries, and continents, and many, many more. In Spanish and in Portuguese. This is in Brazil, the paper of Sao Paulo, the largest in Brazil. In Greek, I was invited to deliver papers on the subject. This is the Beaumont lecture of the Beaumont Medical Club in New Haven, Connecticut, given at the Historical Library of the Yale Medical School, Psychosurgery and Evita's Secret Prefrontal Lobotomy. At national meetings, like this one, and at the meetings of the Congress of Neurological Surgeons and of the American Association of Neurological Surgeons. And I was invited to participate in panels discussing neuroethics. Neuroethics, part of bioethics, raises questions first, the crucial issue of informed consent by the patients, and second, the problem of conflict of interest, particularly surrounding patients with aggressive behavior. Now, regarding dangerousness, society has an obvious interest in normalizing potentially criminal behavior, but it must be done under strong ethical and democratic guidelines and controls. This is an international symposium of neuroethics I participated in May 2016 in Mexico City. Neuroethics in functional neurosurgery is a dynamic field with constant innovation and research. It is essential to apply the principles of the Helsinki Declaration of 2002 and of the Belmont Report of 1974. Now, only democracies are capable of guaranteeing the independence of the ethics bodies. Psychosurgery is inseparable from the political order. Psychosurgery can be used for good or evil, as a treatment or as a tool for control. And to counter this danger, our societies must be kept informed with utmost transparency of the advances being made in this field or of its applications throughout the world. So back to Juan and Evita. This is a photograph of Evita at her peak. And there was an enormous change between 1950 and 1952. The photograph on the right is Evita after the lobotomy. So just as the prefrontal cortex is widely interlocked with the limbic system, basal ganglia, primary and secondary cortical areas, and receives verbal and ideational impulses transmitted from the multimodality associational regions, this is the way we were able to do this research, even in the era immediately before Facebook. We used social networking both in the northern and the southern hemisphere of the Americas. The dominant theme of this conversation, besides functional psychoneurosurgery and neuroethics, has to do with connectivity. Connectivity and the brain. I have described a forensic study of the illness and treatment of Evita Peron, as well as the evolution of functional neurosurgery and or psychosurgery for treatment of pain and anxiety, as well as for behavior modification and personality change to control aggressivity, emphasizing the role that prefrontal lobotomy or leucotomy played. I also try to describe the psychosurgical state of the art in the decade of the 1950s and the neuroethical implications based on the findings that we gain by looking at the interviews given by Dr. Udvarhelyi and learning about Dr. James Poppen's participation and the political scene in Buenos Aires in 1952. This is the human brain, and this is the end of this talk. I want to thank you very much for listening to it. Thank you again.